Good morning. First of all, I would like to thank you all for attending today's webinar with InstantAtlas and the Arizona Department of Health Services. It's great to see a good number of attendees signed up for today's live event. I'd like to introduce you to our guest speakers, first of all. We have Tracy Lenartz, who is a health and planning consultant at Arizona Division of Public Health Services, coordinating Arizona's shortage designations program, as well as assisting with health planning, data, and training around issues related to access to primary health care for Arizona's underserved and rural communities. Joining Tracy, we have Wesley Korteum, GIS coordinator, who was responsible for developing their online tool, the Designation Mapper, which is the focus of today's webinar. Both Tracy and Wesley work for the Division of Public Health Services, Bureau of Health Systems Development within the Arizona Department of Health Services. Tracy and Wesley will, between them, explain how Designation Mapper is helping the Bureau meet its objectives of optimizing the health of Arizona residents. The Designation Mapper tool uses InstantAtlas to create an interactive resource that is being used to inform strategic decisions and assist in the allocation of funding. Following their presentation, Jan Westin from the InstantAtlas support team will run a short demonstration on InstantAtlas server and demonstrate how you can build robust data query systems, community information systems, and area profiling applications. Well, we expect the webinar to last approximately 1 hour, and it will be recorded so that you can listen and watch again or pass to your colleagues. Okay, that just leaves me to pass you over to Tracy and Wesley, and hope you enjoy today's presentations. Tracy, over to you.
Thank you, Mike. Good morning, everybody. As Mike said, my name is Tracy Lenartz. I work with the Arizona Department of Health Services, and I have with me today my colleague, Wes Korteum, who is our GIS coordinator for all of Department of Health Services here. And he is the one who's actually responsible for building our web-based mapping tool, the Designation Mapper, that we'll be giving a demonstration of today. So before we get started, I wanted to just give you a little bit of background information about our department and specifically the bureau that I work for, which is the Bureau of Health Systems Development. Here you can see this is just kind of a very simple org chart of our Arizona Department of Health Services. So we have 3 main divisions: Behavioral Health Services, Public Health Services, and Division of Licensing. Within Public Health Services, there are 2 arms of that: Public Health Prevention and Public Health Preparedness. And you can see the various bureaus under each of those arms. My bureau, Health Systems Development, falls within Public Health Prevention. The mission of our Bureau is to optimize the health of Arizona residents by developing and strengthening systems services to expand access to primary care and other healthcare services like dental and mental health, with emphasis on the health needs of underserved people and areas. We have some main functions. First, we function as the primary care office for the state of Arizona. We get federal HRSA funds to do that work. We work on developing and implementing strategies for strengthening primary care and healthcare delivery systems, specifically to underserved communities. We administer programs to increase the number of providers in underserved areas. We work to identify areas that need improved health services, and then we help those communities apply for federal and state shortage designations. That is my main role in the Bureau. And then we also provide a lot of technical assistance to our statewide partners on everything from those workforce programs, recruiting doctors to their areas, on gaining shortage designations. We provide technical assistance to clinics who might want to apply to become a federally qualified health center or rural health clinic, things of that nature. Our Bureau also has a pretty wide variety of health planning tools that we provide free of charge to our partners across the state. We have a whole host of data. So one of the main types of tools are called primary care area profiles. These are statistical profiles for each of the 127 primary care areas in our state. It has demographic data, health status, health utilization data, shortage designation, those types of things. So we do those annually and post them on our website, and it's a nice source of data for people who are writing grants or doing needs assessments or that type of thing. We can also run that same profile for boundaries that anybody requests of us. So if somebody gives us a list of census tracts or a list of zip codes, we will run that statistical profile specifically for their service area. We have a report called Need for Assistance Worksheet, which is actually part of the federal New Access Point grant, which is for new federally qualified health centers. It's a requirement as part of that grant, so our office gathers all the data and can run that for people. So that also has some demographic data, but a lot of chronic disease related and health status data as well. We publish static base maps, such as all of the health professional shortage areas in the state. And then we also take special mapping requests from our stakeholders. So if they're working on a grant and need a map to go with their grant application, we can do that for them. Over the years, we've always wished that we could have something a little bit more interactive to help people map and explore this data. And just about a year ago, now we got it in the HSD Designation Mapper, which uses InstantAtlas. This is the website for our Designation Mapper, and just a screenshot. And we're going to go ahead and give you a demonstration of it, and then we can take questions at the end, and Wes is available for any technical questions as well. So just bear with me for one moment. I'm going to go ahead and share my desktop and take you live to our Designation Mapper website. Here it is. And so first we'll walk through just kind of the main components. We have the map, of course, in the middle. The map background can change, so whichever, if you like to see satellite, terrain, hybrid, or we'll just leave it on that setting for now. Then on the left-hand side, we have the legend, and you can see as you scroll over, it'll actually highlight the section that you're scrolling over. And then there's various other things you can add or take off of the map. So, for example, if you would like to see the county boundaries, you can click on that or click off to take them away. Over on the right-hand side, we have the data table. This can be sorted. So right now, it's sorted by name alphabetically, but you can also sort it by data, either from biggest to smallest or vice versa. Then if we scroll down a little bit in the page, we have the state comparison rate for whichever data indicator we're looking at, a pie chart, and a distribution chart. So you'll see up on top, we have various geographies that we can look at, and for each geography there is a set of data associated with it. So right now it's on our primary care area geography, and we're looking at total population. You can see on top it says which data set we're looking at. So we're going to go ahead and keep it on primary care areas. If you click on data, you can see the different data sets we have available for primary care areas. We have population density, various races, poverty, and then some physician data. We'll go ahead and do percent Hispanic as an example. It also gives the year of the data, so our most recent data is from 2011. Now, you can see on top, it reflects that we're on percent Hispanic 2011. Over in the legend, as I scroll over, this is the percent Hispanic, and you can see just at a glance by scrolling through where the lowest and highest percentages are in the state. And you can see the high percentages, let me just scroll down a little bit so you can see better. Mostly in southern Arizona, which makes sense since we are a border state. You can also click on an area in the table. So if there's a specific community you are interested in looking at, for example, let's go to Avondale-Tolleson. It will highlight it on the map in orange. That is a Phoenix metro area community, so it's hard to see because it's quite small in geographic size. So if we click on the little magnifying glass right next to the Avondale-Tolleson name, it will actually zoom right in to that area so you can see it a little better. To get back to the full state view, we just click on the magnifying glass over on the state map, zoom full, and it'll go back to the whole state view. We also have the capability to search by address. So, for example, I'm going to go ahead and enter in the address of our state health department. Now, we have to, in order to see it, we need to actually toggle the base layer off in the legend, and then you'll see the marker for the address. We can zoom in. Oops, wrong one. Let's try that again. To get a closer view. And then if you toggle the base layer back on, you can see which primary care area you were in, the associated data very clearly. So that's a nice function because our static base maps, it's very difficult to see, especially in the Phoenix area where most of our state's population is, where exactly those boundaries are. So this makes it a lot easier to see where the boundaries are by streets and by specific address. So I'm going to go ahead and zoom back. And we'll do another example under primary care areas. So if we go to data, let's look at 100% poverty. We can clear selection to take off the one we had clicked on before. So as I mentioned, we can add things like if we wanted to see all the federally qualified health center sites in the state, you can just click that on in the legend, and when you scroll over, it'll actually give you the name of those health centers. And then we can also compare multiple indicators. So if we, let's say we click on the highest poverty areas in the legend, now we can go ahead, change the data back to Hispanic. And you can see up on top that it's back to Hispanic. If we scroll down a little bit, you can make a comparison between those two data sets on the distribution chart. So you can see those highlighted in orange were the highest poverty areas. You can see that they're very concentrated in the high Hispanic areas as well. Across the data distribution chart, the red line is the state average. Now, if we want to clear this selection, we go to this little triangle, which is the menu, and up to clear selection. One of the buttons on top is filter. Right now, we just have counties as a filter. I think in the future, we may think of other uses for this function, but for right now, that's what we have. So you can just click on a county. For example, Maricopa County is where Phoenix is, and it'll just gray out the rest of the state, and you'll only see that county. You can go back to the menu and do clear filter to take that off. Now we can try a different geography. So let's look at counties, for example. Each geography will have different data. There's a lot of overlap, so you can see we still have population, race, poverty, physician data, but now under counties we have uninsured data as well. So we can add that onto the map. There are other functions. For example, you can add text or add a shape. So if you wanted to, let's say you wanted to actually print this map to include in a grant application, you could add some text, drag it to where you want it, maybe add a shape to point out something, and then you could go ahead and go to either print or export it as a JPEG. Reset layout will take away those shapes or text. Now, one more geography example. We'll go to dental health professional shortage areas. We get a lot of inquiries from physicians, especially dentists or community members, about whether their area is designated. This is a nice, easy, interactive way for them to find out. So let's say someone is in Yuma. We'll go ahead, zoom into that area, and then they can just really easily see that they're in a designated area. You could even add in census tracts to see which census tracts are designated or zip codes. Now we also have, next to all these primary care areas, under this little column called Map, here you'll see a page. If you click on the page, oops, hang on, I have to take it back to our primary care area geography. Okay, now we'll try it. If you click on the page, it'll actually bring up our statistical profile for that primary care area. So this is what I was talking about earlier, the report that has demographics, health status, health utilization, and then it has a static base map of that primary care area as the last page. To download maps and GIS layers, we have all our shape files up here, as well as some static base maps. So for example, here are our state's primary care areas. As you can see, like I was mentioning before, it's really hard to tell where those boundaries are, especially in the urban areas. And so it's great having this interactive map that people can more easily see where those boundaries align with. And then we, of course, have to update the data. So something like shortage designations changes on a daily basis, actually. And so we don't necessarily have the resources to keep up with that all of the time. So we try to keep it as current as possible. But I always tell people for the most current information to visit HRSA, which is the federal agency that actually does those designations. So we have a button that will take people right there, and they can check the most current designation. We have a button that takes us to our Bureau's homepage, and then one for help, which just brings up the InstantAtlas help page. And then at the bottom, we also have a link to email us if there's any comments or errors or suggestions. So with that, that is a very quick overview of our site and some of the functions that we have. We've gotten a lot of good feedback from it, and we hope to keep adding to it and updating data as we go along. So I'm just leaving up here our contact info, my email and phone, and also Wes's email and phone. Feel free to contact us if you have any questions at all or need any information. And with that, I will go ahead and turn it back over to Mike.
Okay, Tracy, thanks very much for your presentation on Designation Mapper. I hope that the audience will have a very good understanding of how that application is working and what it's doing for your department. Okay, we're moving on to our next presentation, which is with Jan Westeen of the InstantAtlas support team. As I mentioned at the beginning, Jan will run a brief demonstration showing how the server solution extends the capabilities of InstantAtlas's standalone profile and dynamic reports, enabling live delivery from a database. Okay, Jan, over to you.
Thanks, Mike. And thank you all for joining us here on the webcast today. I'm part of the user support team based here in Houston, Texas, and I provide support to our North American customers for both our desktop and server-based products. So in the next 15 minutes, I'll briefly show you how our Instant Server product works. I'll talk to you about its benefits, and I'll show you an example of how it's being used by one of our clients in North America. So let's start with a brief overview. InstantAtlas Server is a database-driven, off-the-shelf web reporting solution. It can be used to rapidly deploy an entire data-driven website. So these websites are often known as data query systems or community information systems or data observatories. Now, here are some of our clients using these systems in the region. For example, the CDC's Disability and Health Data System. We have the Vermont Environmental Public Health Tracking Query Tool. And we have the Pinellas Indicators Community Information System. You can see that each looks quite different, having been branded to that organization's own requirements. Okay. Well, what actually sits under the hood of these systems? Well, InstantAtlas Server does, and here's a diagram to explain how it all fits together. You can see that at the center, we have a database that's used to store your data. Administrators then use a browser-based website to load and manage the data. Using the same interface, data is then easily published through a wide range of reporting channels using the out-of-the-box user website. Each of these modules are essentially different tools and presentation options for the data that you have stored in your database. I'll explore two of the main modules, data views and profiles, in the live demonstration later. But you can see we have some advanced modules too. One of the modules is the user management module, which is used to control access to and set user permissions on the data and outputs that you publish. InstantAtlas Server is modular, so you can choose as few or as many modules as you need, and then you can add further modules to extend the capabilities of your system later. So how do you actually go about getting data into this system? Well, you can use the same familiar data manager tools that you currently use for InstantAtlas Desktop, either the Excel or Access-based data managers. Alternatively, you can also use InstantAtlas Server to load data from or by linking to data that's already stored in external databases. Now, this option is ideal if you already have a central data warehouse, but you'd like to use InstantAtlas Server's capabilities to pull the data directly from here and deliver them into your presentations. Now, what about the InstantAtlas dynamic reports? Well, they are created in the usual way using the desktop tools and are then uploaded via the administration website. Data is delivered from these reports on the fly from the InstantAtlas Server database, and this means they can be reused multiple times for as many different data sets and presentations as you create. Now, for those of you with dynamic geographies, our Server Publisher module allows your spatial data to also be streamed in on the fly. This means that, like your indicator data, should your spatial data change in the underlying data store, then the maps in the dynamic reports will be automatically updated to reflect this. Okay, so shortly I'd like to show you what these sites actually look like on a live demonstration. But before I do that, I think it's useful to quickly explore some of the advantages that InstantAtlas Server offers, in particular contrasting with some of the desktop software alone. Okay, so the first advantage really is that we allow multiple presentation channels for the same data. Now, what does that actually mean? Well, the philosophy really with InstantAtlas Server is that you work on the data loading just once, and then once it's in your database, you offer this to your audience in a variety of different output channels. Now, you would imagine that the main output channel might be your dynamic reports, in the same way that you do with InstantAtlas Desktop right now. But with InstantAtlas Server, you also can have supporting HTML very accessible tables to support the dynamic reports. We have Excel outputs, downloads for your users to get extracts of your data. And then we also have an output called profiles, very similar to what Tracy spoke about earlier. And profiles are collections of text, graphics, tables, charts, and other content that are usually shown on a per area basis. They are usually a little more static, but what's nice about them is that they allow you to provide context and intelligence to specific areas for any given profile. So really the idea with InstantAtlas Server is that rather than tailoring a single data set to a specific dynamic report, with Server we give you the ability to make use of this data lots of different times and make it available as different outputs. So as well as having a range of different outputs to choose from, InstantAtlas Server also offers a range of different navigation mechanisms for your users to work their way around the portal. And in this way, you can tailor this single InstantAtlas Server system to suit a range of different audience needs. So this can range from simple direct click links or simple lists and trees for your users to navigate to your data, to more advanced wizard-driven self-service portals or dynamic query pages for your more advanced, maybe your specialist advanced data professionals. We also include a search function for searching for metadata. Okay. Now the third benefit is just to re-emphasize that this is a dynamic database-driven streaming solution. So while your desktop dynamic reports need to be manually updated each time there is a change to the data, with InstantAtlas Server, every time you need to, for example, edit an existing indicator or measure, or add a new year's data, or modify your data in some other way, then you can do this once using the administration website, and all the affected outputs will be automatically and instantly updated. There's no need to republish or upload changes to your web server. It's all automatically done for you. Okay, the fourth benefit, it's a little bit techy, but as a server-based enterprise-level systems, there are inherent advantages in terms of the infrastructure that it runs from and some of the security features that offers. So if we begin with a database, your data is stored securely within an enterprise-level database, a database that can be backed up frequently and automatically. Then the administration is done through a secure admin website, an admin website that you maybe make available internally or give people access to via a VPN connection, or perhaps even make it available over the internet using secure encryption. Now, if you do have multiple administrators, then we allow you to set ownership flags upon data sets to make sure everyone can work concurrently on their own projects without stepping on each other's toes. And then, of course, our user management module allows you to securely allocate specific outputs to different user groups. For example, you might allow unregistered users to view a public portion of your website, but decide to hide certain data sets or specific self-service tools to advanced users who are required to log in. The approach you decide to take can be flexible. And then as a final point, I would emphasize again that InstantAtlas Server is an off-the-shelf product used by over 80 different organizations. It can be rapidly deployed onto existing infrastructure, or quicker still, deployed by us in the cloud through a hosted service. Now, using an off-the-shelf product has got clear cost advantages compared to using custom-built systems. And if it doesn't do exactly what you want, it's far more efficient to customize something that's already built and tested than to start again from scratch. And for those of you who already have a data warehouse in place, well, you might not need to use InstantAtlas Server in that fashion as a data warehouse, but you can still take advantage of its ability to link to your data warehouse and then make use of all its tools and functions. Okay, so let's move on to a live demonstration. So I'm going to show you the website of the CDC's Disability and Health data system. If you just give me a second while my screen loads. So hopefully you can see the DHDS website in front of you. And as I mentioned, this entire website is built upon InstantAtlas server. Now, one of the things you'll notice is that it's integrated seamlessly into the wider CDC family of websites. For example, a banner along the top, and if we scroll to the bottom of the page, the footer along the bottom. Styling's being consistently applied using style sheets, and InstantAtlas server provides a left-hand navigation system and also a breadcrumb that you'll notice on some of the other pages to ease navigation between the different pages. They've included lots of different help guides, links to data, links to other resources on here. But you'll notice the two main buttons in the middle of the screen link us to maps and data tables and to state profiles. Okay, this user homepage is fully customizable, and they've decided to give you two routes to get at the main data, as well as some quick ways into viewing some of the most popular items. Maps and data tables is the CDC's interpretation of our data views module. So let's have a look at that first. The way we navigate to our data view on this website is through the use of themed thematic trees. So the idea is that you browse through the trees, for example, general health conditions, and then focus in on a particular theme that you might be interested in. So I'll look at heart health and look at some heart attack data, and I'm then presented with a range of different options. Now, I'm interested in exploring this data 1 year at a time, and that takes me to a page where I can view lots of different presentation options grouped by different geographies. So I can view this data for states and territories within the United States, or I can drill down into that information for census divisions or census regions as well. Okay, you'll notice on the right-hand side of this table that I have lots of different ways of viewing that data. I can view that data in a dynamic report. There's actually 4 different options here, 2 single map options, 2 double map options, and then each template type has been styled differently. We have a standard contrast and a high contrast style sheet for each of them. You can also view the data in a data table, or if you wish, you can download this data directly into Excel or using a CSV format. So I'll have a look at the data table first. And the way they've set up the site is that before seeing a data table, we have to go in and pick the measure that we want to appear in our table first. So I'm going to look at, this is survey data, so I'm going to look at survey respondents who responded yes to heart attack for both disability and non-disability. We then click Update Data Table, and this will stream the data out of the InstantAtlas server database into this table. So you can see the list of states on the left-hand side here, and then the columns of data that have appeared here from the database. Okay, this data table is fairly dynamic. It's fairly interactive. I can, for example, remove data from the table if I don't want that particular column or indicator to appear. I can order my data on specific columns by clicking the little arrow buttons. If I'm interested in finding out a little bit more about what this measure is that I'm exploring within the data table, I can click the little information icon to view some metadata about this indicator. For example, what this measure is called, what the definition is, together with how this measure was created, where it came from, and so on. Okay. Now that I'm done with my looking at my table, I can potentially download this data table into Excel, so I can do some further analysis on it, or I could email a link to this data table directly to my coworkers. Okay, so the data table is just one view of this data. Of course, one of the reasons that you're looking at InstantAtlas is because you want to make use of the interactive reports. Now, these work in exactly the same way as Tracy's done a really good job of explaining in the presentation before me. This dynamic report you see here is exactly the same as Tracy created using the desktop software. It's created in exactly the same way. The difference is that the data in this dynamic report isn't sitting in the dynamic report itself. It's streamed in directly from InstantAtlas server. So as Tracy's already done a really good job of explaining how these dynamic reports work, I won't spend any more time on this. But the key thing to emphasize here is that you'll see this report used in lots of other different places on the CDC website. The difference is that the data that's contained within it is streamed in on the fly from within the InstantAtlas server database. Okay, so I'll now look at our other core module, which is our profiles module. Now, profiles are a little bit more static compared to the InstantAtlas dynamic reports. We navigate to them in the same way through a theme tree for me to obtain the profile that I'm interested in. So I'm going to look at the alcohol use profile, and I'm going to run that profile for the state of Arizona. So a profile is a template of different objects, objects that we call widgets. And these widgets are things like text, tables, and charts that are populated on the fly with data from the InstantAtlas server database. So as an administrator, you pick and choose what text, what tables, and what charts you wish to appear on the screen. And then what InstantAtlas server does is it populates those objects dynamically on the fly with the data in the database. So I'm now looking at this profile for the state of Arizona. If I just want to update that data, this profile with data for Colorado, all I need to do is just change the state in my dropdown. Okay. Now, in addition to some of the components you see on the screen here, we also have the ability to do bar charts, pie charts, scatter plots. Actually, lots of different other web-based content can be included, such as images. You'll notice some hyperlinks here. We can also include some dynamic report components in here as well, if we wanted to. Okay, very similar to the data tables, we have the ability to email links to these profiles directly to our coworkers with the email profile function. And for those of you who like to take away a hard copy of these area profiles, there's the ability to export them to PDF as well. Okay, so that was my very brief look at two of the main modules in InstantAtlas Server. We also have, as I mentioned in my introduction, we have advanced versions of these modules as well to give maybe more technical, more data-savvy users lots more functions for getting at the data that you store within an InstantAtlas server system. Okay, so I'm going to stop sharing my screen now and just take you back to the slide. So this was a live implementation of the CDC's Disability and Health Data System that I showed you. If you'd like to look at this website in your own time, the URL is on the screen here. And if you need any more information about InstantAtlas Server, if you're interested in knowing a little bit more about it, then please do not hesitate to contact us using the details on the screen there. Okay, now that concludes my presentation. I'll now pass you back to Mike for the final part of this webinar. Mike, back to you.
Okay, thanks, Jan. Right, we're now going to open up the floor to questions from the audience. As I mentioned at the beginning of today's webinar, if you'd like to ask a question, as Mary Beth mentioned, to any of today's presenters, please use the Q&A box in the bottom right of your screen, and please indicate who you would like your question to be addressed to. While people are sitting down thinking perhaps what they want to ask, I'm going to ask Tracy a couple of quick questions that had occurred to me as I was looking at your presentation. The first one was, what sort of feedback have you had from people who are using Designation Mapper?
We've had positive feedback. We finished the site last February, but I had some staff turnover a little bit. So we didn't really start promoting it heavily until I'd say the summer, and we did a webinar demonstration, much like this, but a little bit more in depth in early fall of 2012. And so just since then, I've gotten a lot of good feedback. We actually have a partner at our state's rural health office, which is at the University of Arizona, who decided to make a similar InstantAtlas site with some of their workforce data. They have really extensive health workforce data. And so it's been nice being able to collaborate with them. And we hope to do some more outreach to people, maybe repeat a webinar and try to get more people throughout our state trained on how to use it. But overall, we've gotten really positive feedback.
Okay. And have you got any idea of how you might like to develop the tool looking into the future?
Well, you know, just watching your InstantAtlas server. This is Wes, by the way. Sorry about that. But watching your InstantAtlas server presentation there, that is something that I'm definitely interested in and would like to follow down that path, not just for HSD, but for our whole department. That we really like to have a dashboard to show all of the data that we have here at the department. And I've been pleased with InstantAtlas product for showing the HSD data. Plus, we have ArcGIS server, so we could update all these things in the background without having it, the more static file out there. So that would be ideal for me. The only issue for me would be more personnel than anything else, because I'm the only GIS person in this department. So, but it's definitely something that's got my attention.
Okay, well, that's good to hear. Thanks very much, Wes. I have a couple of questions coming in here from Peter Forster. Just let me put these questions forward first. I think there's three that have come up here. The first question is, what is the cost of the InstantAtlas server for not-for-profit organizations? I think that's correct. The second one was, are the users able to upload their own data, connect them with boundaries, and map or run reports? And also, what spatial file formats are supported by InstantAtlas? So, Jan, I think if we could work backwards, maybe if you could look at what spatial file formats are supported by InstantAtlas, and then are the users able to upload their own data, and then perhaps I can take the question about what is the cost for InstantAtlas server.
Okay, so the spatial file formats that the desktop software supports are both Esri's shapefile and mapinfo files, so mapinfo tab files or mapinfo mid-MIF interchange files as well. So if you've got spatial data in either of those two sort of industry standard formats, then you'll be able to use those within InstantAtlas Desktop. In terms of our users are able to upload their own data, connect them with boundaries, and map run reports. At the moment, it's really down to the administrators to create those dynamic reports for them. It's very easy to do, so there's certainly scope for administrators to be able to very quickly and easily produce simple dynamic reports based upon particular user interests, for example. What end users are able to do is, once those dynamic reports have been created for specific geographies, is that they're able to go in and select particular geographies and using the filter functionality that Tracy showed, make selections of particular groups of geography and then filter the data down to those groups. So if the administrators put a lot of effort into producing a very good dynamic report, your end user can go in and say, I'm only interested in looking at the data for these half dozen census tracts, and then basically explore the data for those census tracts only. So I hope that answers your question.
Okay, thanks, Jan. What I would just like to add to that is we do have a new product or service product coming out this year called InstantAtlas Communities. And InstantAtlas Communities is purely a cloud-based method of publishing atlases, and we will also be including the ability to publish profiles. And one of the aspects of InstantAtlas Communities is that you can invite people that you know to come to look at the atlas or the profile, but particularly the atlas that you've created, and you can allow them to upload their own data. It's a cut and paste operation that will connect with the boundaries that you have put up on an atlas. So first of all, the person that wants to look at or wants to upload their own data has to make sure they've got the correct codes that you've used in your atlas, but we make those available to them. But they can work out of Excel, upload that data, and then they're able to see their data against the atlas and any other data that you may have put into that system. We've been trialing that system for just over a year with an organization called the Public Health Information Unit in the University of Adelaide in Australia. And they found it very useful for people, particularly in public health research areas where people have a small set of data that they'd like to put up and compare with a range of existing data, but are not really in a situation where they're going to learn how to use or be able to invest in the software. So more information will come out about that shortly from the marketing department, but by all means send a message to us, say, yep, I'd like to be included in any information that comes out. I mean, we have released that now to a number of invited audiences. So if you would like to have a look at that, please send an email to marketing@instantatlas.com. In terms of the cost of the server, at the moment, we don't have a distinction between sort of not-for-profits or government organizations. We tend to look at I suppose, two types of system. One, which is the very minimum of the modules that Jan discussed, and there probably you're looking at a price for a perpetual license of somewhere around $10,000 to $15,000 for the basic system. Obviously, it's quite hard until we talk to people individually to understand what they might need in terms of additional services from us to help them get implemented. If you move up then to sort of taking all of the modules and a full installation, you may be looking closer to $25,000 to sort of $35,000. But again, those are perpetual licenses. So once you've made that purchase, then you're not having to look at any other ongoing licensing costs. We also have maintenance and support, which is an optional annual contract that we run for people. So the cost is variable. InstantAtlas Communities will be delivered on a subscription basis. So that will be annual subscriptions or longer periods of time. And so it may be that becomes more appropriate depending on exactly what you might need. So please, if you can keep in contact when that comes out, I think that may give you at least two options that you can look at. Okay, we don't have any more questions right now, and I think we're just getting towards the end of our time. So I'd like to say on behalf of Tracy, Wesley, Jan, and myself, thanks very much for attending the webinar. I hope you found it of value and of interest, and the broadcast of the webinar will be available in the coming days, and we'll notify you by email when it's available. InstantAtlas will be running future webinars in 2013, so please visit the instantatlas.com website where we'll display the future topics for discussion.